So Dr. Bilski, in our last video, we talked about how dentists can actually treat snoring, of all things. And now we're going to talk about how they can help migraine headaches and something called TMD syndrome. Could you start? What is TMD syndrome, first of all?
Just old term, temporomandibular joint disorder or syndrome. So TMJ, TMD. It's just where your jaw is kind of clicking, popping,
clicking jaw,
or you're getting headaches. And again, I'm busting chops here. Your ankle bone's connected to your knee bone, and hip bone is connected to your joint up in your jaw in some way. Muscles of chewing in your face, if you have a bad bite, can create a TMJ, a jaw problem, which creates perhaps migraine headaches. Tension, cluster, really bad migraine headaches. Could be debilitating. Some people have to lay down in a dark room, maybe for a day or two, calling work. I can't go to the wedding. My daughter's graduating. There are a lot of reasons why you can't go.
That really disrupts your life, right? No doubt.
So, in our practice, we've had training with chiropractors and neurology people. We have a system that's called True Denta, and what that means is we identify you're the patient with the migraine headache. We make a retainer for you that helps reduce the stress. Now, it's not your traditional bite occlusal guard or bite plane. This is a specialty appliance that it's called a neurotransmitter inhibitor. That means it shuts off the brain firing the muscles to chew or clench. Hyperactivity.
Wow, this is science fiction stuff, man.
It's neuro. Could be it's neuroscience, right? But there's some biology and physiology with it too. So the muscles are being told kind of what to do by the nerves. So the nerves are kind of goofy. The bite's not right. So there's kind of like three things: muscle, nerves, and the actual where the teeth fit together. So habitually, we're always going to put our jaw. Like if my jaw wanted to always go to the left, and I always chewed on the left and never got back into a normal, what's called hinge position, like a door that opens all the time evenly, you're gonna have problems with your teeth. They could break. If you're not having tooth problems, you're having joint problems, that's alerting me that you're going to have potentially some tooth problems. Now you might be 25 years old and have TMJ and migraine headaches. But when I get that patient that's 55, 60, 65 that we're trying to work with, it's kind of difficult. So it's just a way of identifying the patient, giving them a retainer. We have exercises, we have cold laser therapy that we utilize. It just stimulates the muscle fibers to increase circulation. And then we use some ultrasound, just some therapy. And then as you are progressing and feeling better, the muscles of mastication, meaning chewing in the neck, the jaws, the top of the head, the front of the face, kind of all come together by the brain physiology or brain chemistry, figuring out like, oh, wow, I don't have a headache anymore. This is where my jaw should be. This is what the nerves should be doing. This is where the muscles are. And then as we get to that point, then we take the retainer out, which is removable all the time. And then we check your bite with a little sensor that shows where all these little nooks and crannies and bumps and your things that you feel with your tongue, if they're not in a balanced, what's called a balanced bite, it tells me what I have to do.
Wow.
So there's no guessing.
Wow, that's pretty neat.
So it's kind of a nice program.
Wow. Yeah.
It takes a while though. It might take 3 or 4 months to get you through this, so you physiologically get your brain to understand what it's like to not have a headache.
Wow, that's pretty interesting.
The dentist can't do that if they're trained to do that.
I can imagine somebody coming in 3 or 4 months who had a migraine and you solved it, and they're so happy that I should have done this a long time. Like, doctor, I should have. Ow. Does that ever happen? And then can you treat that?
Yeah. Well, sometimes I'd like to do that to them. So we've been telling you that for a few years, but I think what happens is you get, again, realistically and reasonably, the research suggests that about 77 to 82% success rate. So there are, do the math on that.
Yeah.
23% maybe we can't fix.
Hey, if you do have some of these symptoms of headaches, I mean, migraines are horrible, and it could really be worth checking out and considering. So,
and if you are close to somebody that you just feel bad, and then sometimes you get a little indifferent or apathetic when they have one because it's like, oh man, we're gonna miss another one.
Right? Yeah.
Like, okay, go back in the room, and I'll be home later. And it's a lifestyle that you have to deal with. It can be corrected. Now, here's the thing: you might not get rid of all your migraines, but if you're a person that has one a week, or you're that patient that has a constant, like this annoying headache all the time. And we ask the questions, how many days a month are you pain-free? They're like, maybe 2.
Oh, geez, that's awful.
So if we can get you to have, let's reverse it.
Yeah.
You only had 2 days?
Yeah, right.
And so I'm feeling pretty good about myself and extremely happy for the patient. It's not that expensive. It's just, you need to go and have it evaluated. There are plenty of doctors around. We for sure in our area are I think the only ones that provide it. I mentioned a chiropractor to the Ramsey Chiropractic Group. They're aware of what we're doing too, so sometimes we get chiropractic involved with it. So it's not just all me. We go out and get help with other people too.
That's great. Well, could make a huge difference in your life. Consider it. And Dr. Bilski, thanks a lot. This is a really important one to share.
Yeah, for sure.